Alcohol and diabetes, how alcohol could lower blood sugar. Believe it or not, alcohol consumption actually decreases the risk of type 2 diabetes among older women. It's sound absurd. Because for the longest time, we have believed that alcohol has no real benefits. However, recently, a study has found that drinking moderate amounts of alcohol really does decreases the risk of type 2 diabetes, and this is especially true among older women. See one of this at the site of PubMed, find the link in description. There are 20.8 million children and adults in the United States, or 7% of the population, who have diabetes. While an estimated 14.6 million have been diagnosed with diabetes, unfortunately, 6.2 million people, or nearly one-third, are unaware that they have the disease. Recent studies have shown that drinking moderate levels of alcohol, when compared with drinking too much alcohol or no alcohol at most, can lower the chances of getting type 2 diabetes. However, only a few studies on alcohol and type 2 diabetes have included women, and very few possess included older women. Previous studies in the effects of drinking moderate amounts of alcohol, 1 to 2 drinks, and the chance of developing type 2 diabetes have mostly been done on men or both men and women who were younger than 55 years previous. The researchers wanted to study how drinking alcohol affects old women's, more than 50 years old, chances of developing type 2 diabetes. Questionnaires were mailed to the women in the study. The women were asked where they lived and if they had conditions that put them at risk for any other diseases. Waist and hip, height, weight, and blood pressure measurements were taken at the beginning of the analysis. Diabetes, high blood pressure, and high cholesterol had been also reported if these circumstances were diagnosed by a doctor. The questionnaire asked about how much each female exercised and how much they ate. The questionnaire also contained questions about how exactly much alcohol the ladies drank, how often they drank, and what types of alcohol they drank, both and in the past currently. The researchers sent out 2 follow-up questionnaires every 3 to 5 years. These questionnaires asked the women whether they developed type 2 diabetes, what year they were diagnosed, who diagnosed them, and whether they were becoming treated by diet, medicines, and/or insulin. Conclusions. The researchers discovered that blood circulation pressure was reduced the ladies who drank moderately, but it increased in women who drank more. During the study, a total of 760 fresh instances of diabetes had been diagnosed. The extensive research, however, that alcohol consumption in moderate amounts did lessen the risk of developing type 2 diabetes. This is rather significant piece of news as we can now safely drink our favorite wine and not feel guilty about it. Thanks for watching. Please like and share with your friends. Don't forget to subscribe. For more information about how to manage diabetes, visit our site. Click the link in the description.